NU Hospitals at Bangalore was one of the first nephrology urology hospitals in India to start the subspecialty of pediatric urology and pediatric nephrology. Pediatric urology and nephrology simply takes care of complex genitourinary anomalies and conditions amongst the very young children. Some of them require care even before birth in the uterus, which is called as fetal medicine. Some of them require care soon as they are born, and some of them require continued care all the way till they reach adulthood. Pediatric urology encompasses the genitourinary system and takes care of anomalies of the kidney, which include pelviureteric obstruction, which means the urine draining from the kidney is obstructed at the level of the kidney. It also takes care of anomalies of the ureter, which is the tube that drains the urine from the kidney to the bladder. Common conditions like vesicoureteric reflux, where when the child passes urine, the urine not only goes out of the bladder but goes back again into the kidneys, causing recurrent urinary tract infections and decreased renal function. Apart from that, pediatric urology also takes care of cancers of the kidney and bladder in children and anomalies of the testis, which includes undescended testis, which is a condition where the testis does not descend into the scrotum but is still there in the abdomen and needs to be brought down surgically. This specialty also takes care of all penile abnormalities, which includes, to name a few, hypospadias, where the opening of the urinary passage is not at the tip of the penis but much below in the shaft and requires difficult and complex reconstructive procedures. We are also one of the few hospitals that do pediatric urodynamics. We take care of neurourological conditions, that is, conditions where the bladder is affected due to faulty nerve supply, and this could be the result of brain and spinal conditions. We also do complex pediatric laparoscopic urology, keyhole surgery, minimally invasive endourology for pediatric urinary tract stones, and are also one of the few hospitals in the country that do complex reconstructive work using the robot. We hold the distinction of performing the first pediatric pyeloplasty robotic, the first pediatric robotic ureteric reimplant in the world using the CMR platform. Now, taking care of small children with complex renal and urogenital anomalies is not very simple. This requires a consistent team effort, and our department is ably supported by our pediatric nephrologists, nephrology and urology colleagues, anesthesia radiodiagnosis doctors, and the Department of Laboratory Medicine. Going forward, our intention is to preserve kidneys. That is the main goal for pediatric urology. Most of the conditions that the kids have are usually reversible. Only thing is they need to be identified early, and they require an environment where complex care can be delivered in a safe manner.